Joining us now is Dr. Rick Snyder, president of the Dallas County Medical Society. And earlier this month, it was the Medical Society that first recommended aerial spraying.
And Dr. Snyder, I want to start with this point. You know, at that time, the director of the Dallas County Health Department dismissed your suggestion about aerial spraying. Now, a week later, these planes are set to take off tonight. So we got to ask, Dr. Snyder, are you all feeling vindicated this morning?
Well, no, it's not a question of vindication. As I recall, the director never rebuffed or rejected our suggestion. In fact, aerial spraying was always in their arsenal. And in fact, for the last 6 years, what my understanding, the county health department has had an aerial spraying plan in the bullpen when they felt that would be appropriate. And the real question is if that needed to happen. And what they've been doing is a very good job analyzing all the data and crunching all the data, trying to determine what's going to be best for the citizens of the county of Dallas.
Dr. Snyder, is there any health risk for folks out there? I know they're concerned about, the young kids, the elderly population, pets. We hope not to see any kind of collateral damage, if you will.
Well, we looked at a lot of the data. We looked at numerous scientific studies. We looked at the guidelines from the CDC, and really the risk is minimal. And in fact, I spent a lot of time the last 2 days talking to officials from Sacramento and Yolo counties, California, where they have sprayed aerially for the last 8 years, every year except for one. And in fact, in 2005, they had a spray block of over 1 million residents and had no human consequence. And they know this because their health department actually had an active surveillance programs of the emergency rooms looking for any upticks in increase in ER visits. And what they found, found zero human impact to those 1 million residents in 2005. And since then, they've sprayed every year except 2009. In fact, they're spraying this year. And again, they've reemphasized they've had no human impact from that. And when I asked them about what's been their impact on other benign insects such as bees, dragonflies, butterflies, they've actually published a study which they found no impact on the large insects. Now, insects that are about the size of a mosquito, the small insects such as ants, yeah, there could be an impact on that. But also in those areas, I asked them about impact on wildlife and dogs and cats and pets. There was no impact, and in fact, when they do spray, they do not advise their populace to do anything unusual. They don't tell them to bring their dogs in the house. They don't have them bring their furniture in the house.
Dr. Snyder, in this conversation that you had with Sacramento, did that crew use the same type of product that's going to be used in Dallas County? The Clark group that's going to be spraying is going to use a product called Duet. Is that the same as what you've seen or talked to in Sacramento, where they didn't have any problems to bees and other livestock or dogs or cats?
They're using a pyrethrin or pyrethroid. It's a different brand name, but it's the same generic medication.
Okay.
That's correct.
Okay. And so do you expect that this will be a one-shot deal for Dallas County, or could we see several flyovers in order to take care of the problem?
Well, it's my understanding what the county is going to be doing is to continue to do what they have been doing, is monitoring the mosquito populations by using their traps. And over the next several days, they will see what the mosquito population is doing and see what the infection rate and make a decision. So there could be additional spraying depending on what type of response they get from their mosquito traps.
All right, Dr. Rick Snyder, thanks so much for joining us this morning. We certainly appreciate your insight.
Thank you very much. You're welcome.
All right, a lot of our viewers